All right. Thank you so much, Bahar and Jana, and thanks very much for inviting me to share a little bit about what my organization, Spinal Cord Injury BC, has learned and is trying to do around welcoming newcomers with disabilities in our communities. I'm in Nanaimo, BC, on the traditional territory of the Snuneymuxw and Snuneymuxw First Nations. Spinal Cord Injury BC is an organization that offers services around the province as well. So if you haven't ever heard of Spinal Cord Injury BC, I don't blame you. We changed our name about 12 years ago, and we're an organization that was founded in 1957, so that's more than 60 years. And when it was founded and until 2010, we were called the BC Paraplegic Foundation or Association. And we were called that because at the time of our founding, people with quadriplegia, which is paralysis that affects all four limbs, didn't survive their injuries very often. And so they weren't included in the name at that time. But thankfully, due to some great medical advancements in surgery, we are called Spinal Cord Injury BC because we represent people with forms of paralysis that affect two limbs or all four limbs, caused by traumatic or non-traumatic spinal cord injuries. And our goal really is to help people with spinal cord injuries and similar disabilities and their families adjust, adapt, and thrive as they deal with a life-changing injury or the ongoing challenges of living and aging with a disability. You might ask, why spinal cord injury? As a disability population, we are not the biggest by any means, but it's considered in the research the most serious injury a human body can sustain and still survive. There are huge costs to the individual and their family and the healthcare system. Even if our system covers all the in-hospital care, there's costs to adapting your home, to finding accessible housing, to covering your out-of-pocket medical and medical supply expenses, getting training to re-enter the workforce, for example. And what we've found is that peer support, that is the support offered by someone who's been through that experience themselves, helps ease the transition back home, helps to develop skills for independence and create networks of support around the province, around people with disabilities like this, so they can thrive in their community. It's a permanent disability and has ongoing chronic complications. And those complications require a specialist level of knowledge in order to maintain high quality of life and good health. And that specialist knowledge is not available everywhere. So an important role we play is to try and disseminate that information to people in whatever primary care situation they have available to them. Many conditions share the characteristics and needs that people with SCI have. For example, spina bifida, muscular dystrophy, multiple sclerosis, polio, and many other neurological conditions. Even though they wouldn't be considered, strictly speaking, spinal cord injury, the needs and concerns are very similar, and we consider them under the same sort of big tent of spinal cord injury. One of the crucial components is that spinal cord injury is so much more than just paralysis. If you saw me, I don't know if you can see my wheelchair, but you might think my disability is that my legs are paralyzed. I can't walk. But you probably wouldn't know that everything in my body below the level of my waist doesn't function the way it's supposed to. That means the sensation in my skin, the circulation, the integrity of my skin is more fragile below the injury level. I don't have that feedback from my legs to tell me when I've wounded myself. My bone density is lower. my bowel, bladder, and sexual function is different. And it's different with every person, even if they have the same level of injury. And so you can see how it's really tough for each individual to completely, fully understand and be able to share with a healthcare provider what their injury looks like and how it affects them. But it's also not easy for clinicians and medical professionals to understand that just looking at someone, let alone people in the community who aren't from the healthcare sector. So you might wonder, what's a disability organization doing in this sector? We're all very siloed sometimes, and it's not an area that Spinal Cord Injury BC has spent a lot of time on in the past. But we have a service called our Infoline service, and it's a 9 to 5 Monday to Friday hotline for any questions related to disability support needs. And so we realized through that, we get about 4,000 calls per month or per year from people with disabilities and their clinicians and caregivers and family members. And it was through that we started to realize that we saw some gaps in around welcoming newcomers with disabilities. So to put it briefly, spinal cord injury can happen to anyone. It's more common among men 18 to 35 in terms of work-related injuries, vehicle accidents, and sports, and more common in women 45 and older for non-traumatic causes like cancer, blood vessel abnormalities, that sort of thing. But it can really happen to anybody for lots of different reasons. But we also realized that we were starting to get calls from newcomer organizations and newcomers in our peer community that were difficult for us to answer. Here's some stories. I can't come out. This was someone responding to me, inviting them to come out to an event. Our peer support events are often to help people develop a community of support around them. And this person said, I can't come out because my power wheelchair isn't working. Who repairs these? IFHP helped me get it, but they said I have to ask PWD for support now to repair it. They say they won't cover repairs because they didn't buy it. And my worker told me I need a doctor to write a letter, but how do I find a doctor? This is someone who had been living in the Fraser Valley for 2.5 years by that point. I am also moving out of my place so I can find a place closer to wheelchair basketball so I can play every week. I can tell you that when I heard that last comment, my heart skipped a beat, because there's nothing as short of stock in short availability in BC as accessible housing. And once you have an accessible place to live, we don't want anyone to let that go before they have another place booked and set up. And I was immediately really worried for this person that they didn't realize how hard it would be to get accessible housing closer to wheelchair basketball where they wanted to play. Another one is more recent. I'm having trouble getting a disability pension. They're asking me for documents I don't have. I'm running out of my medical supplies and I don't know where to get them. And I don't have a doctor to prescribe them to me. So mobility is really just the tip of the iceberg. Those medical supplies are considered sort of non-hospital healthcare. And so in our system, they're not covered very well. And so if you aren't on PWD, or if PWD doesn't recognize the wheelchair that needs repair, it's expected to come out of pocket. And navigating that process to get support or coverage is incredibly complex. Just for the average person, let alone someone who's new to BC. We started to realize, and this was about 2015, 2016, when I first started at SCIBC, right around the time the Syrian refugee crisis was starting or was happening. And we're starting to see, like, get a better sense of how high the barriers were and how few disability related supports there were that were informed by that newcomer experience. We realized that the sort of different types of support they were getting weren't necessarily playing well together. And sadly, full inclusion is so much easier with the social support and financial resources. And that those are two things that most newcomers just don't have access to. Newcomers fleeing conflict might even have that come with medical and social concerns that couldn't be adequately addressed at home. And so they're bringing urgent, complex health concerns with them that that they might not have a full understanding of or know how to ask for help for. This is an example of the complexity. This is from a brochure that we use, and it describes the progress or the journey from injury to living in the community for people who have an acute, that is like a sudden onset spinal cord injury. And the idea is to help people understand the pathway that might be ahead of them. But if you can imagine negotiating this journey as a newcomer when so much else is also a brand new experience, we started to really understand that if our health and social support systems are so complex for citizens and residents, how much worse is that for newcomers? So our peer support services are sort of our bread and butter main program. And we look at this as the best way that peers, people with spinal cord injuries, are the best resource for information and support, because they have the experience with managing complications and living with their disability. And that a network of that support around you is where you can really draw from when you have questions, when something changes, when you need support or information. And we do that through coffee meetups and larger events. The top picture is from our Jericho Beach Day, where we do a bunch of activities and sailing and tennis and a big barbecue. And the bottom picture is from our Whistler Adaptive Adrenaline Camp that we do. And those events are really like the bait. They're to encourage people to join so that they can meet other peers and develop that community around them. We also have an online peer support program with sessions several times a week. And we also have information resources that promote sharing of adaptive equipment. If people have old or gently used equipment, they can pass it on. Our Infoline and resource centers were really how we first became keenly aware that there was a gap. I've told you a bit about this already, but Infoline's available to anyone. You don't have to have a spinal cord injury. So if you're working with someone and have a question about disability in BC on any topic, you are most welcome to contact us. And it's staffed by 3 people living with SCI, 2 of whom are social workers, and the others are rehab counselors, and all have lived experience of disability. So as I mentioned, it was through our Infoline that we started realizing that there was gaps. Particularly, we were getting a lot of questions from community-sponsored refugee teams who were suddenly realizing that the families they were supporting or who were going to arrive needed wheelchairs or accessible housing, and had really complex concerns that the teams just weren't prepared with information about. Jana was an active member of our peer community at the time and a settlement worker as well. And because of her own newcomer experience, was sort of the go-to person for questions about it. And we had the opportunity to apply for a one-time only grant from Vancouver Coastal Health. And Jana came to me at our Whistler event and said, hey, we need to do something. There's not enough information available. And right around the same time we'd gotten this grant, we were like, Yes, this is a great idea. So our welcome guide for newcomers with disabilities started as out of a focus group of newcomers from our peer support program. And initially we started through a partnership with a settlement organization to do the guide as presentations. But as a fairly small proportion of the newcomer population, that was logistically pretty hard. And Jana also had lots of contacts in the settlement sector and helped us sort of work with the feedback of settlement workers to make sure that the guide content we were developing had some, we had good feedback on it and were able to customize it to the needs of the people who would be using it. This is the point at which it became the welcome guide for newcomers with disabilities. This all started in about 2018, so it's been quite a long journey. We decided to focus it on newcomers with physical disabilities and other mobility impairments because that's the population we know the best. And it includes all kinds of newcomers, immigrants, international students, refugees, asylum seekers. And this guide is really tailored to the needs of settlement workers working with newcomers with disabilities because we were new at the process of creating content to be translated. And it ended up being quite a comprehensive guide. And Jana's going to tell you about how she, with BC Refugee Hub, has used the guide content to create brief info sheets that could be easily shared and translated. Here's the, I think Bahar is going to put the link in the chat. Here's the guide. It's brand new as of last week in terms of like the final usable copy. There's two versions. One's an interactive PDF and the other is optimized for print, which is not quite finished yet. But we plan to, here's a few little examples. We geared it based on the BC welcome guides and tried to use it as a chance to fill in the gaps and not duplicate what was already in the welcome guides. Some examples of those gaps are how BC's geography and climate is different for wheelchair users and people using mobility devices. And a lot of the content collected and presented here is from people who use wheelchairs or people with disabilities based on their own experiences in like Prince George or Fort St. John. So it really comes from the experts who live with those climate concerns and geography concerns as well. We're pretty proud of it, but we definitely want to learn how we can do this better and improve our resources to make them more usable and useful for newcomers and the people who support them. In the future, we're looking to offer more translated resources like our wallet cards and form and support a newcomers with disabilities peer support group. We have one to a certain degree right now, but it's tailored toward newcomers or well, anyone who is from a South Asian background. But we're looking forward to hosting one that's more sort of broad. Version 2 is we're aiming at sort of tailoring the welcome guide to the newcomers themselves in terms of speaking in first directly instead of third person, which the current guide does, and to share the template for other organizations to use. This is an example of our recent translation of our wallet information cards, which are used to communicate with healthcare providers about complications. Has just recently been translated into Ukrainian. Livingwithsci.ca is our rehab focused information website. And mostly what we learned is that the health and disability needs might not even be known to the individual with the disability, to the newcomer themselves, to focus on building relationships, and out of that, communities and programs to be flexible and plan to support newcomers so that they can fit into the community you're developing, even though, it wasn't built with the newcomers sort of barriers and constraints in mind. To identify champions like Jana and work with them. And also just to be flexible, to think broadly, to overcome barriers to participation. Often those are transportation and cost. And one example is Jana helped us bring together a group of newcomers to come to our 3-day, 2-night Whistler adaptive adrenaline camp. And it's nearly free. I think we waived the fee for most of them. But transportation is a really difficult thing to Whistler. There's no accessible transportation. And so we rented a cube van and put like 4 wheelchairs in it, and then drove those 4 newcomers in a sedan separately, because that was the only way we could find to transport that many power wheelchairs. And we had a great time. You've seen some of the photos from that camp. So that's a very quick and over my time a description of our newcomer welcome guide, and we are definitely still learning. So I am really looking forward to hearing any feedback that your audience, this audience has, and any way we can improve or add to our info database about issues of concern to newcomers and the people who support them. So thanks so much.
Hi, everyone. Thank you so much for having me. Thank you, Bahar, for this great opportunity. And I'm very honored to have worked on this project that is very close to my heart with spinal cord injury and BC Refugee Hub. Today I'm going to speak about the info sheets that I worked on, and what topics we have chosen to be presented for newcomers, refugees with disabilities, and their settlement workers. So I'm gonna start a little bit of talking about the challenges and the barriers refugees with disabilities face. So for decades, and due to different shapes of conflict, refugees with disabilities are one of the most affected groups that are left behind and almost absent from the agenda of the development plan during conflicts and war. And this is outside Canada when they are displaced in refugee camps and other countries. The challenge becomes bigger when they arrive in Canada, because it's not like the challenge becomes bigger. It's because they are already displaced and they are moving to another country. So whether they are government assisted refugees or privately sponsored refugees or refugee claimants. The reason that stand behind this, behind the challenges, is lack of disability lens within the settlement and resettlement programs. The disability lens is not mainstreamed all over the settlement and resettlement programs, and also the lack of specific data and numbers on refugees with disabilities, as if this group of people does not exist or they're not there. So this is one of the challenges that I'd like to highlight on. And I'd like also to share my personal experience as a newcomer and with a disability. In 2014, I arrived in Canada as a newcomer myself with a physical disability, and I faced a lot of challenges, including employment, and many different challenges could come up where, like, I lacked the Canadian experience, and then I had difficulty to find jobs. Also, housing was a big issue for me, lack of availability of accessible units and long wait times. I remember I waited so many, I waited like number of years in order to get an accessible unit. And also transportation. It was not clear for me, like for example, if I want to go to a doctor's appointment, it was not clear for me, like the route and the guidance and the info, and I was unable to travel by myself, and I had to use the handy dart for the first 3 years. um and also navigating the system in British Columbia is really challenging. And in my mind at that time, I would say I wished that I had this magic advocate or settlement worker who would connect me with all the resources and the support I needed. Um, According to the newcomers with disabilities form summary and um, that was organized by the Disability Foundation and many disability organizations. Um, we could look at the top challenges that a newcomer with a disability would face. So I picked the top three challenges that I thought that was really important to talk about. The first one is the barriers to acquiring information. And this would include general lack of awareness about existing disability services on the part of the settlement workers, newcomers organizations, and even disability organizations themselves. For example, the newcomers with disabilities reported being given a list of organization and told to Google the information themselves. So this is not applicable, which many of the newcomers found it difficult in the face of language and cultural barriers. The information barrier is compounded by the lack of the training given to settlement workers regarding disability services. So yeah, this is one of the challenges. The other challenge is need for one advocate. So a lot of newcomers reported that they prefer to work with a one single navigator, a person who does all the necessary research and guidance and information. They also identified that there is a need for a better follow-up and advocacy plan from disability organizations, particularly in the area of applying for disability benefits, provincial disability benefits, and greater availability for interpreting services. The third challenge would be inadequate services. The greatest number of services gaps identified by newcomers fell into the category of services for refugees with visual disabilities, which includes long wait times for specialist medical services, and also refugees with physical disabilities reported repair of adaptive equipment and accessible housing were also identified um, for long time waiting periods. Um, so the idea came up. So me, Bahar, and Jocelyn talked about after working on with spinal cord injury on the newcomer guide. The idea came up is to create a 3 info sheets that would be a summary of different topics from the newcomer guide. So I'm gonna present the topics that we already worked on. Um, and this is an online resource. And Bahar, would you be able to share the link of the info sheets in the chat box and the video, please? Okay, great. So the first info sheet provides a summary about major topics for newcomers with disabilities who recently arrived in Canada and are exploring driving, driver assessment programs, and vehicle modifications and accessible parking permits. Um, the info sheet provide links where, like, steps where to start first. Also, in addition to public transit options and accessibility features, including each option, and special rates for persons with disabilities in BC. The sheet also, um, okay, yeah, the driving, public transportation, and settlement includes also a checklist handout to help newcomers with disabilities and their settlement worker with disabilities related support during their first year in Canada, in BC, sorry. The second info sheet is about employment, housing, and income supports. The sheet provides a summary about employment options, training supports, and self-employment, accessibility, and environmental accommodation in the workplace, in addition to accessible housing, subsidized housing, and home adaptations, accessibility in BC. Also, there's a brief on income supports, benefits such as PWD, provincial disability benefits, and also the disability tax credit, and the registered disability saving plan, and the federal provincial fuel tax rebate for refugees with disabilities in BC. And also, we have included some resources from the Disability Alliance BC, help sheets on the disability tax credit and the RDSP, and the registered disability saving plan and the PWD benefits on step what to start first. I'm going to be sharing the resource, the info sheet. Sorry, just give me a moment. Yeah, so I have shared the links for the help sheets from Disability Alliance BC. The third info sheet is about primary and mental health care. The sheet provides a summary about primary and mental health care, including the interim federal health program, the IFHP, and how to get a family doctor, how to access a specialist, healthcare providers, and how medical equipments and supplies are covered, such as mobility, medical equipment like a wheelchair and other equipments, and also how you can get home care programs and dental care and mental health care in BC. The other resources that also I was part of creating the Okazi guide to the disability tax credit and the RDSP for newcomers with disabilities. The guide is a result of a partnership between the Disability Alliance BC, Plan Institute, and the Ontario Council of Agencies Serving Immigrants. And this guide is designed to help frontline workers in settlement agencies and advocates to introduce newcomers with disability to both the disability tax credit and the registered disability saving plan. And also it explains the benefits of these program and the eligibility criteria and the whole process.